Hi, my name is Jordan Melugin Abla, and I am a senior nursing student here at Bethel College. The name of my poster is, or the title of my poster is Biases in Prenatal Health. My PICA question is, in women of color, does implicit bias compared to known bias influence access to prenatal care? The reason why this topic was chosen was because there are many women in my family close to me who seem to have issues getting pregnant in that prenatal stage, whether they're unable to get pregnant, having losses, things of that nature. And it seems to just be on the rise in my own personal life and around me. And so I was very interested in the topic. I wanted to see if there were any consistent underlying factors that maybe played into why women were having so many issues getting pregnant. So what we do know about prenatal health is that the sooner that you get it, the better. You have better outcomes, better birth weights, better pregnancies, better labor and delivery, things of that nature. And it's really best to start getting prenatal health before you even get pregnant, before you even are trying to get pregnant. Like I said, the sooner the better. We know that stress can play a factor into it, overall health, diet, exercise, weight, things of that nature. In my research, I also found that race disparities also play a huge factor into whether or not women get adequate access to prenatal health. This issue is relevant because, like I said earlier, in my personal life, I can see it be on the rise. And this is such a hard journey for so many women who really wish to have children and they're not able to have it. And so I believe that if we are able to find an underlying factor, we can start making changes, and that way less women will have to go through this. Of course, there are certain things that play into it that are outside of the women's control, and luckily there are other ways to start a family, which is very awesome. But I know that it's such a personal issue for so many women. Okay, so as I stated before, we know that these factors play a role into it. We know that, we want women to have a good BMI before they start getting pregnant. We know we want them to stop doing risky behaviors, don't drink alcohol, don't do drugs, things of that nature, stop smoking. We know those issues. However, all of those issues seem to be put minority women at an increased risk. So they affect minority women more than they do women not of color. And so it's just very interesting to see why that issue is. Another reason that women lack access to prenatal health is that they lack appropriate prenatal health is because they lack access to prenatal health. So this could be either they have bad health insurance, they might be insured, they just don't have good enough insurance to cover the costs, cover expenses, things of that nature, or they just don't have access at all to prenatal health. Furthermore, they might not even know to seek out prenatal health when they are supposed to. And that could be due because of cultures. A study that I read stated that culturally, women view pregnancy differently. So they might not know that they should reach out to get help. They might not know that something is an issue. They might reach out to a doctor way late. They've been pregnant for a couple months, then they decide to go see a doctor, or they just might not know that there's even an issue to begin with. They don't know what to look for. And if there is an issue, that culture might handle it differently. So there's some cultural differences as well that I thought was very interesting to read that study. And so some of the recommendations, because it does affect minority women at a higher risk, is it might sound simple, but it seems to be hard to do, but implementing and using all of the different cultures around us, all the women of color that we know, whether it's utilizing the patient, which we should do, obviously, take a good assessment of their history, the stressors that they have, see what's specific to them, ask our coworkers, and then utilize all the other women and people, men and women in the healthcare field who might be of another race and culture to say, and ask them what's really going on, what does seem to be this biggest issue, what is your outlook on this, and how can we be better? How can we implement changes? How can we offer more help to our women of the same, or to our patients of the same race and culture and things of that nature? Like I said, it seems pretty easy to implement. You would think that it'd be really easy to implement, but it can be kind of difficult. Awkward conversations, things of that nature. There's a lot of reasons why people wouldn't want to. And unfortunately, race and biases do play a role into that. And so that's just another issue of, you have to check yourself whenever you go to the door, say, my patient is the biggest priority. So what can I do to help them achieve the best outcomes? Another article that I had read, which plays into the recommendations, is simply getting access to resources. So in this particular study, surveys were sent out to healthcare providers, and surveys were also sent out to the patients of those healthcare providers. And there were a lot of things that played into it. You know, some of the women were participating in risky behaviors like drugs and alcohol while pregnant. They didn't feel like they had a strong enough connection with their healthcare provider. They didn't want to say that. They didn't want to be judged. They didn't want to take the chance of maybe the cops being called on them, CPS, all of that. And then also doctors said that they didn't know where the access to resources was. So the women, another thing that they stated was that they were never getting any community resources when they left the appointment. So they had no idea what was available to them in their own community should they need any help, either with the prenatal process, or even if they had been pregnant and then they needed baby supplies or anything of that nature. They didn't know if it was there. The reason why the doctors didn't give it to them is because the doctors themselves didn't even know about the community resources. So that's just another implementation that we can start in these appointments, in healthcare providers' offices, hospitals, things of that nature. I understand. I mean, there's a lot of community resources. It's very common for a really good nonprofit organization to be in the works, and not very many people know about that, which is unfortunate. But I believe that if, as a community, we got together and we made a list of all the different resources that are available to women, pregnancy centers, other nonprofits, anything that provides any type of prenatal care, if we could get a list of that and then simply put it into the healthcare provider's office or the hospitals, that would increase the knowledge of these women of what they have access to in their own cities. And then whenever the women leave the appointment, we just could make sure that every single one gets a pamphlet of this list and make sure it goes into every woman's hand. And that way, should they need help either with resources, finances, or like I said earlier, baby supplies, whatever they could need, they know where to go. And then also just education, using different community resources, working with policymakers to start maybe educational programs. I mean, just simply knowing that you need to get to the doctor and be checked out before you even start trying to get pregnant is huge. And not a lot of people know that. And so just continuing on the education and on the importance of seeking out prenatal health, I believe would make a huge impact on so many women. A lot of women don't know about their cycles, when they're able to start trying to get pregnant. I mean, there's just so much knowledge deficit in this area, which is to no fault of their own. But as people who specialize in this area, if they would work on education programs and then those resources as well, I believe it would make a huge, huge impact on women's ability to get the appropriate prenatal health that they need. So in conclusion, it's very difficult. It's a hard journey. A lot of women struggle with this inability to get pregnant for, like I said, many reasons stated previously. But I do believe that there are very tangible ways to be able to decrease that number. And in doing so, be able to provide women a healthy journey on the road to motherhood. Thank you.